Have you ever wondered where the expression, knee-jerk reaction comes from? The expression knee-jerk reaction means reacting without thinking. The expression stems from the medical field where the jerking motion of the knee on tapping is recorded to test someone's patellar reflex. If you are wondering what reflexes are used to protect the body automatically. They get us away from objects that may hurt us before they hurt us. We need more speed to respond to dangerous painful stimuli. So, we let our spinal cord do that fast work for us. One example of a reflex is the patellar stretch reflex. Today you will learn about the process of conducting a reflex knee test, also known as deep tendon reflex or patellar reflex. You must perform a regular reflex knee test on Mr. Jones at his doctor's office. Are you ready to get started? Great. Let's begin. Reflex hammer. There are a variety of styles to choose from, but we will be using the Taylor, also known by the name tomahawk reflex hammer. The head of a reflex hammer is made of rubber. This helps to ensure that it does not hurt when the hammer taps a tendon. Instruct Mr. Jones to sit comfortably on the examination table with his legs hanging freely. This positioning allows for relaxation of the hamstring muscles, making it easier to elicit the knee reflex. When testing a patient's reflexes, you will need to tap directly on the tendon that connects the bone and muscle you want to test. The tendon feels like a tight strip of tissue under the surface of the skin. You have to hit on the patellar tendon. This tendon is located just below the kneecap. Grab the hammer lightly to ensure that you do not apply too much force when you tap the tendon. Perfect. Now use the reflex hammer on the knee. Reflex testing only requires a single impact with the hammer. This stroke should be done quickly and firmly, tapping the center of the tendon. Notice how Mr. Jones' leg extended involuntarily at the knee joint. This is the knee-jerk reflex or patellar reflex. Tap the tendon with the least amount of force possible to make a muscle flex without causing pain while still eliciting a reflex. This can take some practice to get right. If you notice exaggerated or repeating responses, it is known as hyperreflexia, a condition in which a muscle repeatedly contracts when it is stimulated. This condition usually indicates a neurological disorder. And if there is no response, assess whether it is due to an error or a medical problem. In order to ensure that you tap the tendon correctly but no response occurs, you should do it several times. With repeated reflex tests, you can ensure that your test results are correct and not due to an error in your method of testing. Having no response to tendon stimulation is called hyporeflexia, which also indicates a neurological problem. Let's compare reflexes on two muscles. Use the reflex hammer on the knee. When testing reflexes, it can help you gauge the response by comparing the same muscle on the opposite side of the body. Comparing the responses can allow you to spot abnormal responses. Observe the reflex results for diagnosis. If the muscle reacts correctly, the nerves in the muscle are communicating with the brain as they should. If the muscle does not react well, then there is an issue in the nerves between the muscle and the brain. This problem could be caused by a variety of issues, so you will continue with additional medical tests to find the source of the problem. Excellent! You have completed the reflex knee test simulation successfully.